Hi, everyone. Welcome back to our YouTube channel, Staying Compliant with KW Advanced Consultant. My name is Keisha Wilson, and I'm the founder of KW Advanced Consultant. So welcome back. We're going to be talking about one of my favorite topics today, meat. No, I'm not talking about steak or chicken because I'm actually vegan, but I'm talking about the acronym MEAT. Monitor, evaluate, assess, and treat. How are providers documenting using meat in the medical record? Now, oftentimes people associate meat with the risk adjustment realm, HCC, but I also like to use it when I'm talking about documentation as a whole. If you think about the 2021 and 2023 revisions, we're looking to see how providers are analyzing, assessing, monitoring their patient. What is the overall medical decision making? What has the patient come in today, and what are the providers doing for the patient's conditions? How are they treating? Are they assessing? What is their overall medical decision making? And so you can see why I like to use MEAT when I'm talking just about documentation as a whole. But with MEAT, especially with the risk adjustment realm, we know it's very important for the documentation to be there, to be consistent, and it also affects the overall diagnosis code that's reported for HCC. But for general documentation, it should just always be clear so that you're reporting appropriate diagnosis codes. They're coded to the highest level of specificity, and this shows the medical necessity of whatever test or treatment is being done for the patient. So let's dive into MEAT. Monitor, evaluate, assess, and treat. How are the providers monitoring the patient's conditions that day, the chronic conditions? Are they documenting signs and symptoms that may show disease progression or disease regression? Right, what's going on with the patient? What do they come in today? Is it clearly documented? Remember, the note should be clear and consistent and concise from the chief complaint, the HPI, exam, and medical decision making. So now we use monitor, right? We know they should be monitoring these patient conditions. But how are they evaluating these conditions? Are they reviewing tests, lab tests, MRIs, EKGs, whatever tests? Are they being reviewed, and are they applying it to what's going on with the patient? Are they counseling the patient that day of risk and benefits, or whatever's going on with the patient? What does the counseling look like? Well, are you assessing medications? How are they doing on the medication? Are they responding? Is there a side effect to treatment? Do you have to stop medication? Do you need to increase medication? Is there side effects that's happening? And as I'm mentioning side effects, I'm thinking about diagnosis codes. As you assess the documentation, you also want to keep in mind diagnosis code, diagnosis specificity, codes that we should report that tells a story. So we know if a patient is not being compliant to medication, that's a diagnosis code, but that should be reported because that shows that if there's an exacerbation to the condition, we know exactly why, because the patient was being non-compliant to the medication. How are you assessing the condition and addressing it? Are you, again, stopping medication? Are you counseling the patient? Are you coordinating care with another healthcare provider? Let's say this patient has other chronic conditions. Are you counseling them? Are you picking up the phone and calling the other provider? Is it clearly documented in the record? Are you analyzing maybe any external records that may have been done? And then how are you treating the patient? Are you stopping medication, increasing, as I mentioned, sending them for MRIs, CAT scans? Are you going to follow up with them maybe in a week or 2 weeks instead of 3 months? Are you sending them to physical therapy, assessing modalities? All that's documented in the record. And as I'm talking about this, I know some of you may be thinking, like, yes, this really does apply when you're thinking about the 2021 and 2023 evaluation and management, because it's all with a provider's assessment and what does documentation say, and is it clear so now that the diagnosis codes can be reported accurately and to this higher level of specificity. So let's take an example. Let's use diabetes type 2. This patient has come in for a follow-up visit. I said type 2 because we know with diabetes, oftentimes in the record, it may not be documented the type. So another thing that's important that if there's inconsistencies or ambiguity in a chart, you want to query a provider. You also want to educate them and let them know the importance of documentation, the importance of using M.E.A.T, the importance of being consistent with their documentation so that everything can be reported. But then remember, the medical record is also a legal record. So you want to be consistent with what's documented in the record. So type 2 diabetes, the patient comes in for a follow-up. They're on metformin. The A1C is elevated to 8.1. With further discussion with this patient, the provider finds out that this patient has been non-compliant with their metformin for the last month, which explains why now the A1C is elevated. So they reviewed lab work. Now they're having a conversation with the patient on the importance of being compliant. Let's say this patient has other chronic conditions, CKD, hypertension. We know one can cause the other, one can be due to the other, one can affect the other. So now this education is more detailed. The providers letting them know the importance about just managing their health and the overall condition. The provider also decides to pick up the phone and call the GI doctor as well as the cardiologist because now it's a team, right, managing these chronic conditions. And now instead of seeing the patient in 3 months, the provider wants to see the patient back in a month. And before the patient comes back, the patient's going to do a repeat of the blood work so the provider can analyze the A1C in the next visit. So now it's clear from the HPI all the way to the medical decision why exactly the patient has come in today and what the provider is doing to treat and manage the patient's condition. So you see how we used the term M.E.A.T? We saw how they were monitoring, evaluating, assessing, and treating the condition. And if you think about it with documentation for 2021 and 2023, they're analyzing, assessing, and we have the medical decision making. Remember, when we're reporting these visits, it's still E&M codes. So it's important that documentation should be consistent and have a flow. So I hope that this gives you a clear picture of how to use the acronym M.E.A.T when you're looking at a record, whether you're coding it, whether you're auditing the record, it should be clear. And again, if it's not, you just want to have a education session or a discussion with the provider and let them know the importance of their documentation and what guidelines say and why they should be consistent. And now when you're reporting the diagnosis code, everything should be coded to the highest level of specificity. So we have type 2 diabetes. We know we're reporting the metformin. We know we're reporting the non-compliance to medication. We know that there's other chronic conditions that's being monitored and treated as well. And we're going to look in the ICD-10 book, and we're going to look at diagnosis sequencing so that codes are reported accurately. So I thank you guys for joining today with M.E.A.T. Leave comments. Let me know how you're using M.E.A.T, if it's helping you when you're assessing the record. Like and subscribe and share, and stay tuned to our next YouTube video. You guys have an amazing day and stay compliant.